Hey everyone, it's Dr. Ashley, pediatric emergency mom. Happy Monday. So in topic request, someone had requested to talk about Fifth's disease, which is a fairly common childhood illness. The reason for the topic is this person said in their area they had it sounds like an outbreak of fifths, so something that they hadn't really seen before, and then had seen lots of cases like going throughout the school, and so lots of kids affected. So this is caused by the virus Parvo B19, so Parvovirus B19. And we call it fifths because it's the slapped cheek virus. So I remember learning it as like 5 fingers of your hand, slapping cheeks with 5 fingers. So fifth's disease, also known as erythema infectiosum. So this is like kind of your run-of-the-mill virus. You can have runny nose, you can have a little cough, body aches, fever. And the funny thing about this virus is when the fever goes away, so you're thinking, oh, they're better, no longer have fever, that's when the red cheeks pop out. And I'll never forget, my older son had this years and years and years ago. We were doing something, we were supposed to be around other people, and he had a little fever for a few days, and then the fever stopped. So I thought, like, yeah, all right, all good, we're good. And then he got the cheeks. And that was the first time, like, oh wow, hadn't seen that before. Like, it's the first time you've had that one. So it's certainly not uncommon, and it is something that we see, but we do see it in kind of waves, right? Because if one child has it in a daycare center, then it's very contagious, so it's more likely that other kids are going to have it. Adults can also get Fifth's disease. Adults may have more joint aches or polyarthropathy, so multiple joints aching, less so in kids having that. The really concerning thing about parvovirus B19 is that it is very dangerous for people that are immunocompromised, or including like sickle cell disease, but people that have bone marrow abnormalities to begin with. And so what it can do is it's called aplastic crisis. That's kind of like we have to learn this for boards and we have to know it. I've only seen it once or twice, so that part is thankfully not very common. But that virus gets in the bone marrow and into the cells that make red cells. The cells that, if we don't have enough red cells, right, we become anemic, and it totally shuts down. It's a very simplified version of what happens, but totally shuts down. And so then these patients end up needing blood transfusions and can get very sick, and it could be life threatening. So while I say like it's not an uncommon childhood virus, it can be dangerous to people that are immunocompromised or already have like hemoglobin abnormalities. The treatment is like we always do, symptomatic care. So if they feel really bad with fever, Tylenol or Motrin for the fever. Also Motrin if you have body aches. Tylenol doesn't work as well for body aches because there's no anti-inflammatory component. And just making sure they stay hydrated. And yeah, as long as they have fever, they're going to be contagious. And so keeping that in mind as well. Hope you all have a great day.